Today, we had the opportunity to meet people where they were at by opening a third and independently standing location for the SUPeRAD Clinic. It's an opportunity to offer individuals who are pregnant and postpartum with substance use disorder a chance at unbiased, unstigmatizing, trauma-informed, integrated care.
Many of you already know this, the SUPeRAD Clinic, which is the Substance Use and Pregnancy Recovery, Addiction, and Dependence Clinic. The SUPeRAD Clinic initially started at the main university campus and quickly filled from a half day to a full day, and then expanded to South Jordan, and now is expanding here. And that's really because there's such a large need in our community.
There's been a lot of trauma for people in medical settings, especially people with substance use disorder. And a lot of people fear receiving care. They fear hospitals, they fear authority figures. And so giving somewhere for people to go where they feel completely safe and not judged is huge.
I found them when September of 2020, when I just found out I was pregnant with my first child, and I was deep in my addiction. It was the scariest time of my life. I didn't know what I was going to do, if I could even be a mother, if I could even get sober. And I took to the internet and I found the SUPeRAD Clinic.
In the deaths in Utah from 2017 to 2020, 40% of people who died in the state of Utah who were pregnant or postpartum had a history of a substance use disorder. And so really this is death is a real thing that we worry about. We're trying to prevent, we are literally trying to save lives here.
Our primary service that we are providing is prenatal and postpartum care. That will include contraceptive care, ongoing reproductive health care, and we do have a gynecologist on service who can do some high-risk, high-need gynecology care. In addition, we provide peer support for those who do have a substance use disorder and are looking for that peer support navigation, which offers the opportunity to access groups and someone who's available to support them. We have Connect to Health available, which is Google or the yellow pages of resources. These are undergraduate volunteer students who spend somewhere between 2 and 4 hours a week in our clinic, helping individuals access food services, health insurance, housing, childcare, you name it. If they need it, we're going to access it. We also have on our team ultrasonographer. We do our own lab draws, and sometimes that can be very triggering or very difficult, so we're able to get your blood work done. And then we have direct access and connection with cardiologists for your heart care and pulmonologists for your lung care. The other thing we offer in an indirect manner is mental health care. And one of the things that we have is a wonderful partnership with the residents within the psychiatric department and the triple boards who are able to spend 6 months with us and provide psychiatric care alongside with their attending who's available to them.
Now I'm a mom and I have a job, I have my own car, my family trusts me with keys to their house, and I never thought that would be possible. Without the SUPeRAD Clinic, I don't think that I would have been one of those mortality statistics. If I hadn't have gotten sober, I don't believe I would have made it to give birth to Oliver.
Give some resources, even a little bit of resources, and watch what people will do. That's what the SUPeRAD Clinic is to me, because they got conversations going, they got care flowing, and they got people all like holding hands legitimately around a population of people who never felt like they had that before.
I have 4 years and 3 months sober. And I would just like to say to anyone that's struggling, whether you're a mom, you're pregnant, or you are just hopeless and still on the streets, that there is hope. There is possibility to get sober. If I can do it, I believe anyone can do it. And SUPeRAD is the key to that success.